Surgical site infection. So most common cause for the post-operative morbidity and most common cause for the delay in the discharge and most common organism involved is the Staph aureus, and prevention is optimization of the patient, that is malnutrition if present, so well nutrition, prevent the prolonged pre-operative hospitalization should, and diabetes mellitus should be controlled. Serum albumin should be less than 3 grams, and steroids should be off or minimum dose before the surgery, and if any remote infection, first treat it, and stop smoking 1 month before surgery. Movement of the OT staff should be limited, and adequate sterilization of instruments are needed, and adequate ventilation, that is laminar flow, and 15 air changes per hour should be present. At least 3 fresh air changes should be present. Avoid the hypothermia to the patient, and pre-operative skin preparations are hair removal should not be done. Use only the electric hair clipper should be used just before the operation table. Scrubbing should be 5 minutes before the surgery should be done with chlorhexidine solution in alcohol base. Painting should be done with chlorhexidine solution with centrifugal pattern. How? From the nipple to the mid thigh, including the external genitalia. This external genitalia should be painted last, and how many times? It should be of 1 time and should dry on its own, and prophylactic antibiotics should be given. The best time of giving the prophylactic antibiotics, it is just before the induction of the anesthesia, and next best is 30 minutes before surgery, and next best is 1 hour before surgery. And if it is a class 1 wound, that is clean wound, so these prophylactic antibiotics are not required. If it is a clean wound with implant, that is class 1D, and a clean contaminated wound, class 2, so need prophylactic antibiotics. If it is contaminated and dirty wound, prophylactic antibiotics plus therapeutic antibiotics should be given, and repeat the prophylactic antibiotics if surgery is prolonged, that is twice of the half-life of the antibiotics. So example, cefazolin, its half-life is 2 hours. If surgery is prolonged for more than 4 hours, we need to repeat the prophylactic antibiotics, and if there is any excessive blood loss, and also we need to avoid putting the drain also.